Okay. Welcome, Mobina, to the Muslim Care Center podcast, where we talk about mental health and addictions and leaders like yourself and professionals that work in this area, and how you can help people, Muslims, non-Muslims, and just really, especially in this, I think we're now 13 months in COVID lockdowns, and how mental health and addiction issues have been skyrocketing. So I digress. Let's do an introduction. Mobina, Hasan, please introduce yourself. You do a lot of work with the Muslim Food Bank and others. And so please introduce yourself, your background, and we can get started.
Hey, Assalamu alaikum, everyone. So thank you, Tariq, for inviting me today. And thank you, Yusuf, for supporting with the recording of this. Really appreciate it. So a brief introduction of myself. I identify myself first as a mom of two beautiful souls. I'm also a daughter of parents who are very proud of me. I'm a wife of a man who believes that I'm a superhero, a business owner where my staff thinks I need to have more time for myself. And above all, the reason why you've invited me today is because I'm a traumatologist, I'm a clinical social worker, and I help people get unstuck from their past. And this is my second profession. First profession was in corporate world, which lasted around 20 years prior to moving to Canada. So we moved to Canada in 2008, and since then I have been in this profession.
And when you talk about the corporate world, it is a big transition to go from the corporate world to mental health care and counseling. How did that happen? How did that transition or that decision to change your career path?
Interesting you asked that. So both my parents were in business. So I was basically groomed to be taking over the business. And my parents encouraged me to get into the business grad school, MBA. And basically, I spent 20 years in business world. I met my husband there. We had a global capitalistic career for 5 years, both of us, and then we finally settled in Bangladesh. And my husband also being from the business background, my in-laws were in business as well. So I lived a perfect incubator life to think only of the bottom line for many, many years. So moving fast forward, why I transitioned, I was just not successful in my life as in the corporate world. It wasn't making sense to me. It wasn't meaningful, and I wasn't growing. Like I felt I was just stuck in that place. And then a spiritual experience happened, and I call that the story of 2 women and 100 chicken. I actually had 100 chicken in the car, and I saw 2 women plucking feathers from the skin on the road, chicken feathers from the roadside. And I was grocery shopping or wet market shopping, call it in Bangladesh. We lived at that time. And when I saw them, I felt gross seeing that. And I didn't think much of it. And then after a couple of days, my husband said to me, wish you would have bought a little less chicken. And that question actually triggered me. And I was like, okay, is this really meaningful? Those women were plucking feathers and here we have leftover. And is this really meaningful life? And that was the time we were moving to Canada. And that was the time when I said, okay, I'm not going to go to Canada and be in the same capitalistic environment and go back to business or work over here. And that's when I decided to move into social work. Yeah.
And that decision, because it is dealing not only with your own psychology, because to hear traumatic issues from multiple people, multiple problems, it does take a lot of mental strength and emotional strength to be able to do this kind of work. And as you know, one thing is physical health, and when somebody's physical health is deteriorating, but in terms of quality of life, if somebody's mental health, if they're depressed, if there is a relationship that didn't work out, or a death in the family, or a financial situation didn't work out, or a loss, there are many reasons that people go into mental health issues. So taking that on, that's a very big responsibility. How are you able to manage yourself when you have to hear day in, day out all manners of problems, big and small, that people have?
So Tariq, here I hear a couple of questions, and I'm a storyteller, so I would like to share my story prior to I answer a couple of your questions there. So I struggled with mental health myself, and I did not realize what it was, and it was from a very young age. Both mine and my husband's side of the family are from the military background. My both sides of paternal and maternal parents, grandparents came from India in very horrific situations. So before I was even born, my grandparents, my parents, uncle, aunts, they all lived through that trauma. And it was, of course, undiagnosed, untreated, no awareness. And now I was the first one on both sides of the family. And now I'm born, and I'm like very young, and I'm noticing that there's something wrong. Like even at a young age, I knew there was something wrong. If today I think of it, I recall being very depressed. And I probably, like from a very young age, like even at the age of 6 or 7, I used to think, oh my gosh, it would be better off if I was dead. And I still recall thinking, like from now, like at this time, I still recall thinking in those days that I used to think, oh my gosh, if I could write note, and I couldn't write at that time, right? I was so young that if I could write a note to my parents and just tell them that how I am feeling, and maybe I'll just tell them I want to die. So I struggled through that mental health at that time. So it was a very lived experience for me. And and there were various reasons, as I said, traumatic experiences of the family, a lot of conflict in the family, and of course, absent parents. They were struggling financially, not struggling that way, but full-time working in their own business. So the responsibility of bringing me up and all my cousins in the 3-generational home where we all lived was on uncles and aunts to take care. And one uncle did surely take care of all the female cousins, and there was incest as well in the family. So it was just a lot going on. And at the age of 7, I remember my parents taking me to a psychologist, and I literally ran away from there because I knew the psychologist would put me in a madhouse, and I was mad. And then it was, of course, I got a good beating after that. But that's the story of my mental health. So when I was growing up, it took me, let's say, till early 20s to really recognize that I was depressed. And this was not normal. Thinking of death and not wanting to live was not normal. And slowly, I self-care, coping methods, reading books, but it was never out there. I never shared it with anyone. And eventually, I meet my husband. And that's when he said, oh, I feel you're depressed. You're reading all these books that you're depressed. And so life became a better with him, with the graduate school, living the world. And then when we moved to Canada, that's the time I realized that no, I need to do something which is meaningful, and whatever I was doing was not meaningful for me. So your question on how I deal with it right now, I went for my own therapy, intensive therapy, trauma therapy, and the meaning I draw from my lived experience is so helpful that I can support people. I understand them. So it's not just listening to them, but listening to somewhat similar type of stories that I have gone through, and then being able to provide them the support that they need. So yes, it's a very rewarding experience to be able to help people at so early in, and they don't have to wait like I had to wait, like in their, like I got my mental health support, I think I was 40 years of age, like where I professionally went to a therapist and got that support. Yeah, so that's a lot of content I just gave you. Sorry about that.
No, that was very powerful, because I think a lot of people, whether they have mental health or addiction issues, they want to know that whoever's helping them knows, and because you've had your own mental health issues, I think that really helps you help others, because you've been there, you've been in that darkness like other people are in, and somebody who's gone out the other side. And that leads me to say that in terms of your breakthroughs, like how do you find, just in terms of the therapy that you received, the help that you received, how did that how do you find from before you went into treatment and therapy and counseling, before you went into that, your life before, and then the time period in which you had therapy, however many weeks or months or years, and then to kind of this maybe cathartic other side of where you have tools to manage your emotional states. I know that's a lot kind of thrown at you there, but just in terms of that arc of where you were through the treatment, through the counseling, and where you are now, and how you're able to manage your own mental health issues.
So, Tariq, the first challenge which I noticed going through my own mental health was my own emotional regulation at a young age. And that's why my parents took me to a psychologist, because I was very angry. I was a very angry child, a lot of tantrums. And that continued actually throughout my teenage. So a lot of acting out behaviors, and parents couldn't make sense of what was happening. And then because of my emotional regulation, I felt I was also having challenges in my relationship, especially with my parents and my siblings and my intergenerational big home that we lived in with everyone. And everyone was having problems with everybody else too. So mood regulation, relationship issues, and then not being happy. Just like, okay, whatever I did, even with the accomplishment, there was always this negative narrative that was going on in the back of my mind. So just not being comfortable or at peace with myself. And then the 100 chicken and 2 women story happened, and moved to Canada, went into social work. And social work programs are very reflective programs where you have to do your own journey and discover yourself. And that's the time then I realized, oh, I have to go get some professional help. And then I did. And once I did, I could feel that, oh my gosh, there's a big fog or a curtain taken away. And then my relationship improved with my parents, and I could support them. As I healed myself, I noticed I was healing my parents as well, because of course my father is 80 and my mother is like mid 70s. They would never go for mental health help. And so I was the one, I feel, who helped them, helped my family. So it's like one person who heals, then it is like, okay, how is that ripple effect affecting the family? So we are, as a family, in a much better place as I changed my profession. And interestingly, my sister also changed her profession and went and educated herself in mental health. So yeah, so quite a ripple effect for all of us.
And did your other family members, did they also go for therapy treatment as well? In addition to your sister?
No, nobody did. My parents, of course, are in complete denial, right? So my father was in the military, PTSD. If I ever tell him you have PTSD, he says, soldiers don't have this. What is this PTSD? Don't talk to me about these fancy words. I'm a soldier. And he was a fighter pilot, so you can imagine where he's coming from. No, nobody did.
This kind of stiff upper lip and grin and bear it, and don't talk about your problems. That type of attitude.
Right. We only were allowed to think from our head, no emotions, and I acted out with my emotions. I thought with my head, but behaviors were very emotional driven. So there was a lot of disconnect or discourse there.
And in terms of your well-being now, compared to how you were with the therapy, your therapy, was that several months or is it ongoing? Or for those that aren't aware, I think a lot of us, we if we're Woody Allen fans and we talk about Woody Allen and his going to his therapist and his psychiatrist and that type of format, or Carl Jung or Sigmund Freud that's sitting in that chair and talking about childhood and mother issues, and just to the stigma or the misunderstanding of the work and how it helps people for mental health issues. How can we explain to the audience that this is kind of the format and this is what the potential outcomes could be based on the work?
So Tariq, my first round of therapy was when I was, I think, just turned 40. That was 12 years ago. Yeah. So, and it was intensive trauma therapy, because by that time I was already aware of the trauma. I did a lot of research of what type of therapy I wanted, and I went for that therapy. And then I was not a trauma therapist at that time. I was just a clinician. And then when I did that trauma therapy, I realized that how effective that specific type of therapy was. So I'm referring to eye movement desensitization or reprocessing. And that is, the abbreviation is EMDR. So I did EMDR therapy, and then I went and trained myself. And so now, as a clinician myself, as a trauma therapist, if there's a trigger for me, I would go to my colleagues and professionals to get that help. Still now, to be very honest, maybe it's important for audience to know that all therapists have their therapist. So if there's a trigger, I do get help. And interestingly, as I was telling you, that there's incest in the family. So when I went and told my parents said, denied initially, but then they accepted and cut off the uncle. So I didn't have to do therapy for that specific trauma, because that trauma got resolved when my parents cut off the uncle. So what I'm trying to say here is, not for all traumas, therapy is really required. And then a couple of years after that, the trauma gets resolved. But then I went back to my parents and I said, in a very dramatic way, and I said, I forgive you. And my father, in his naive, very innocent and very honest way, asked me for what? And that was another trauma for me. And we still, as a family, laugh about it. But then I had to do therapy for that specific event where my father asked me for what. So what basically I'm trying to say here is that we may think we have trauma, it gets resolved. We may think, oh, it's such a small event, but we may need more help for that. Like for me, I didn't need help for the incest at all, but I needed help for this other one. And it could be a very small incident like this. And then when I work with clients who have similar stories as mine, I may get triggered. And that's when I would go and speak to a colleague and sit down in the client chair. So it's an ongoing process. And the message which I'm trying to really pass on here is that it's okay to get help. Even trauma therapist goes and gets help.
The kind of help that that we're talking about, are you able to walk us through the structure of how, just what somebody could expect in terms of, coming in? Is it more discussion? Are you more listening to what they're saying, or is it a guided kind of, how do you feel about this? Or could you maybe describe how a session would look like, or is everyone individual in how you'd approach?
So every therapist have their own approach, but there is a standard industry practice. So I'm going to talk about that. So the first step is I recommend everyone to book some time with the therapist, couple of therapists. Most of the people would provide 30 minutes free consultation, no charge. Meet at least 3 therapists, and that would give you an idea whether it's a right fit between you and the therapist. That the therapeutic relationship is very critical, more critical than the type of therapy. Once you know the right therapist and the therapeutic fit, discuss with them their approaches and what your goals are. So the way I work is I ask my clients, what do you want different in your life in 1 month, 3 months, and then 6 months? And then we start working towards those goals. I do, or every therapist would do a psychosocial assessment to understand based on what the client want to achieve. And then use those specific interventions which are a fit for the client, their goals, as well as what the therapist is trained in. So every therapist is trained in different approaches and methods.
And in terms of your, for just talking about COVID, and COVID has created a lot of mental health issues, depression, anxiety, different types of psychosis. What are you finding before COVID and now in 13 months into the COVID crisis? What are the common ailments that people are having because of being isolated, lack of socializing, how we used to being able to sit in restaurants, to be able to go to the office? Like, what are the common ailments that people are coming to before COVID and now in COVID that are a marked difference?
So last year, around the same time, I was noticing clients more experiencing fear, and fear leads to anxiety. And it's not that people are not experiencing anxiety right now, but it is more of depressive symptoms. So anxiety is there, but more associated with sadness. So anxiety is driven by fears, depression is driven by sadness. So what I'm noticing is people are fatigued at this moment. And that's why and so many losses everyone has experienced in some way or the other. And that's where depressive symptoms are more prevalent at this moment.
And what you're saying about sadness leads to depression. And, I think, again, maybe in our community to understand these terms, depression, anxiety, and psychosis. I know these are big terms and big definitions, but let's talk about depression. So in terms of depression or sadness leading to depression, can you maybe walk us through just that process of somebody coming to you that has depression for a different reason, and what some of the therapies and treatments that are available for people with depression?
So when a person would contact a therapist, generally they would not say the diagnosis. They would say, I'm feeling low, or I don't know what's happening. I can't sleep. I can't eat. I can't focus. So they talk more about their symptoms. There are some very savvy people who would have already read about those symptoms on internet, and then they start using the word, I'm depressed. So when a person would come in and they identify those symptoms, the first thing I would do is run a psychometric testing, send them the user platform. I send them those screening. They complete it in the session with me. If it's a virtual session, if it's an office session, they would do it in the office. And that would right away indicate to me what is happening with them. Are they meeting the depression criteria or not? And then, of course, there is a history-taking process. And then the most common approach in terms of therapy for depression and anxiety is cognitive behavioral therapy. And we work with cognitive behavioral therapy. And it's good results with CBT. Yeah.
And CBT, or cognitive behavioral therapy, is that the Q&A format where a lot of questions, getting the patient to open up about the why, the reason? Could mental health issues be exacerbated with physical health problems if somebody's significantly overweight, not really taking care of themselves, abusive relationships, or it's each individual has maybe multiple factors that could be causes of depression, or in absence of those external issues, they just have a natural tendency to be sad and depressed. What is it's such a big field, and I know myself, we've all felt low in different ways for different reasons, whether we have a reason or we don't. But in terms of the cognitive behavioral therapy, how do you measure it? How do you measure the scale or the intensity of somebody's mental health issue?
So first is, as I said, the psychometric testing that tells us the severity of the issue. Then second is there are different approaches within CBT as well. So my approach is I would ask the client what they want change or different in 1 month. And I would not go into deeper issues unless the client is ready to address those deeper issues. In the profession, it is common terminology used is, if you peel the onion, there is more that comes out from there. So if we speak about talking more about the deeper issues and the person is not ready for it, they don't have the time or the capacity, financial, we need to help them. This is my way, I need to help them in the moment, what they're experiencing. So CBT is excellent to deal with in the moment what the person is experiencing. Now, in terms of what the therapy looks like, it's changing thoughts to change emotions, as simple as that. Changing behaviors to change emotions. So cognition and behaviors, if you change it, your emotions change. So when a trained therapist would sit with a client, it is a lot of cognitive restructuring and the negative narrative or the thoughts that is done in the office. And then there is recommendation of certain changes in the behavior, which changes hopefully the chemicals in the body to reduce the symptoms of depression. Yes, and if someone wants to do deeper work, the more underlying issues that has led to depression, I would have that conversation with them if it is trauma related, and even if it is not trauma related, I would use EMDR. So I'm trained in both methods, and those are my preferred methods.
And EMDR, what is that? Because terminology like CBT, EMDR, I would say the vast majority of the general public may not understand these methods, but EMDR, in a previous conversation, you said this is also a very effective modality for mental health. Please describe what that means and what EMDR does.
So EMDR initially came in as a treatment method for treating trauma. And the way it works is that our memories get stuck when the trauma happened. So the brain processes the information in the moment of that trauma, gets stuck, and then later on in life, when the triggers happen, the mind and the body goes back to the memory or the subconscious memory of when the trauma happened. And that is when a person goes into that emotional distress state. So the way EMDR works is we help the brain process that information with a balanced thought, left and right brain, emotional and cognitive brain. Basically, we help that brain to get connected. And instead of the brain just thinking from emotional state, which I was doing as a child, or the way my father does, cognitive state only. He processes trauma cognitively. With EMDR, you start processing the trauma or information using both lobes of your brain. And the actual technique of doing it is bilateral stimulation to the body. And there are various methods of that bilateral stimulation to the body as well.
And what could be like, maybe just a hypothetical situation, obviously confidentiality, but if we could walk through like a case study, it can be just a general one or not specific, but let's say somebody comes in for, anger issues or resentment or something like that, and then they go in through the treatment. What can be because I think what I've seen in myself, and I'm sure others have experienced, is these repetitive thoughts of different things from the past, whatever they may be, and it's almost like a loop, and it just kind of almost feeds into this kind of negative emotional state. It's almost like instead of the greatest hits, it's like repeating the worst things again and again, which result in just continuing this loop of let's say depression or anger. What would the EMDR, like, if we can walk through somebody that is going through it and how it helps and how long it takes for them to kind of get out of certain repetitive negative mental states?
So Tariq, of course, I won't be able to share any client situation here, even hypothetically or without names, but I can share my own. because I went through EMDR myself. So what I was telling you previously, that when I disclosed to my parents that there was incest in the family, and my parents was completely in that denial, I was very traumatized. I was not traumatized because of the incest. I was traumatized that my parents were in denial. A couple of days after that, they cut off the uncle. So my trauma got resolved because I was traumatized. My emotional brain was activated. My nervous system was in that state of one narrative, that they don't trust me, they don't believe me, they don't care for me, they don't love me. And then once they cut off the uncle, the narrative changed. And it's like, okay, they believe me, they trust me. So I never went for EMDR for that. However, when I went back to my father and I said, I forgive you, and he said, why? Sorry, what he said was, for what? That was my EMDR session. So now, when I went to the EMDR, prior to that, I was angry, upset, that it took me so much courage to say to my parents, I forgive you. I went through my own healing journey. I was invalidated. I was not heard. I was not understood, all those negative narratives. So when I did my EMDR, interestingly, it was only one session. The new narrative that came out was that whatever was happening in that big ancestral home, 3 generations, and my parents were absent, they did not know what I was going through and what I went through, and it was not intentional. So the new story was, when my father said, for what? It was not that he was not validating me. The new story that created for me through EMDR by left and right brain connection was that my parents were not even aware of what was happening. So the moment the narrative, the story changes, you find relief. And that is what EMDR does. There's a new cognition, new story that develops with the connection of the neurons shooting between the left and the right brain.
So the habituated emotional pattern and thought process in a negative way about a certain incident, the EMDR through the process can shift that emotional pattern, thought pattern that's negative and debilitating to a new understanding of the same incident in a different way that creates a different thought pattern and a different emotional pattern that's more positive.
Perfect. You summarized it so well. I'm just thinking you are the EMDR therapist here. Perfect, Tarek. You did a great job there.
Well, you explained it very well, and that was the understanding that you provided for me. And now people, as you know, are resistant for this. Like, a lot of people understand to lose weight and physical health, you have to take medicine, or you have to take vitamins and exercise, what have you. But what runs the whole show is the mind and the brain and the thoughts and the emotions and strategies and tools, because we can be in a good mental state in a certain period of life, but then something happens, and then we're in a terrible emotional state. And I would say, as a father, if I'm in a negative state, as an example, it has an effect on my wife, my children, the people around me. In terms of mental health having such an effect not only on the person experiencing it, but the people around them, let's maybe talk about how we talk about trauma, and one person's mental health issues can affect other people, and in a negative way, and maybe traumas that people experience when they're younger, and the behaviors that people hurt other people intentionally or unintentionally, and in that arc, to break that cycle of these patterns. And you'd mentioned earlier that you've done therapy for other therapists, and therapists do get therapy as well, but for families and people that need support because a loved one has mental health issues, maybe let's talk about that holistic view, how mental health issues affect the immediate family and the social circle of that person, and how to address that.
So Tarek, this is the concept of intergenerational trauma, right? And if one person is experiencing mental health issues and they go untreated, there is likely potential of home environment which is not very healthy. So the person who may be going through mental health issues may not recognize themselves, but maybe the family recognizes it, or maybe the family does not even recognize it, but then it manifests in different ways. Employment-related issues, relationship breakups, parents experiencing mental health issues, and then children going through substance use. So it manifests in different ways, in very complex ways, which we may not even recognize it, but it does manifest. And that's the time most of the people would show up in our offices, when they start noticing these signs and symptoms. So what my message to people is that if you do recognize that things are not right, something is off, there is no harm in having a 1-hour conversation with a professional and asking their advice. Like when I was growing up, as I said, at the age of 7, I knew there was something off. My parents knew there was something off. They took me to a psychologist. I ran away. But I was showing symptoms of anger, but my parents did not recognize at that time. Of course, there was no awareness that we had intergenerational trauma starting from grandparents, because how in horrific state they migrated. And then my father being in the military with the PTSD, and how my parents had to make up their business and being emotionally away. But then it was showing up in my behavior. But everybody above me, my parents and grandparents, uncles and aunts, they were in complete ambivalence that it was their issue. So if you start noticing something in any family member, in your employment, in your relationship, go speak with someone.
And when you say off, would that mean, could it mean like being withdrawn? Could it be tantrums? Could it be isolation, or just addictive behavior? Maybe let's talk about the off. Well, feeling off. Maybe describe some of those symptoms of feeling off, like lack of motivation, lack of drive, or anger, resentment, these type of things.
Yes, everything you said.
Yeah.
Also,
go ahead.
Mm-hmm. Add
Please
on to it a negative narrative. I am not good enough. I can't do it. My colleagues talk about me. My boss never recognizes me. So a lot of negative narrative, a lot of resentment towards others for not being supportive towards them, and blaming their own negative narratives on others, besides all the long list that you told me. So this piece, what I'm saying, is majority of the time is missed.
And you said blaming others. That's interesting. So when people start blaming others for their problems, like blaming, as you said, maybe in the workplace or maybe in the family, or blaming somebody else for their problems, that is a telltale sign.
Mm-hmm. Right.
And in terms of, like, even things like paranoia and psychosis, when it becomes very extreme, I think a lot of times the mental health issues in families could be so common, people think that it's normal when it's not normal, and they don't know that it's not normal. And so these telltale signs that maybe some families, it's so common amongst family members that they don't know it's not normal. Could that also be a lot of undiagnosed mental illness? Just like you said, your father wouldn't accept PTSD as a reason for any issue. The denial of mental health issues, is that a big problem that you face as well?
Right. So that becomes the norm, right? So when there are symptoms around, like when I reflect right now, all my 4 grandparents had PTSD symptoms. My uncle aunts who were born to those grandparents had emotional regulation issues. To tell you the truth, I did never notice my parents having emotional regulation issues, but my parents were very withdrawn in the sense that they were very physically present for us, very active with us, but emotionally not connecting with us at a cognitive level. So what basically happens is then it becomes a norm in the family. And then now, like, for example, I have my children and my family, and my husband also comes from a military family. Again, interestingly, his father and my father fought the war on opposite side, right? So that's another dynamics in our family. So my husband comes from military PTSD background as well. And now we have these 2 kids at home, me and my husband dealing with our own issues. And now we have the teenagers, which we have to deal with. So what is happening in a family like this is his norm and my norm, coming from our previous intergenerational family background, now becomes the norm in our family. And if I won't have done this trauma specialization, I guess this intergenerational trend would have continued. So
Wow.
the problem I see is the norm here.
Is the normalization of mental health issues, which can keep repeating itself unless professional help is provided to disrupt that negative pattern, which has become normalized.
Right. So it's just acceptance that these symptoms are normal. This is how every family operates. My family operated, my grandparents operated. So now my immediate home operates the same way. That symptom becomes the norm.
And by having this objective support through a counselor from a therapist that can see you objectively and your dynamic in your environment and your relationships objectively and see it, because I think a lot of us that are in certain relationships and environments may not necessarily see how it all interplays with mental health issues, but by having an objective person, a counselor, a therapist, to be able to see the whole package objectively and unbiased, is able to diagnose it, because when it's normalized mental health issues within a family and an individual, it's hard to see it objectively. And by having a professional like yourself and others to be able to see that objectively and be able to see this is a cycle that's destructive and repetitive, and this is how we can break out of that generational trauma.
Correct. And Tariq, that is why I have around 40% of my clients presently are therapists, like counselors themselves.
Yes.
So that's what I specialize in. So again, as a therapist, we have all the skills and the tools. We can objectively look at others, but when we look at ourselves, it is difficult, and that is why even as a therapist, we need to go to a therapist. So people who are not even trained in mental health, it is really important that you do go get your help.
Absolutely. And I know we allocated 1 hour for this discussion and interview, but there are two important items that I wanted to discuss, and they all kind of are related, but modern day issues and things that I think are exacerbating mental health issues is addiction to online kind of situations, whether it's online pornography or social media, or now kids today don't go outside and play. They're fixated on the TV, the 24/7 entertainment of anything and everything that suits their interest, or social media worlds, and the toxicity of that kind of online where 8, 10, 12 hours are being spent online. And this is a modern day issue in this last 20 years where people would rather have these online kind of experiences than real world experiences, whether it's youth or adults. With this kind of issue and addiction to technology and social media and the what possibly pornography, or even whatever issues there are online, in your practice and in your experience, are these becoming much more prevalent, and are a lot of people kind of communicating with you that most people would rather be on devices rather than interact with one another in reality?
Yes. We call it process addiction. And process addictions are very common. And with the substance use addictions getting so much coverage and so much information and programs and supports available out there, I notice a lot of parents would say, oh, at least my kid does not take cocaine or cannabis. They're just on their technology. So the process addictions are undermined because we start comparing them with substance addictions. And it is getting more and more prevalent. The question is why they are getting prevalent, and what is the method or the protocol, or as a clinician or for the parents to help with that. So my opinion is they are getting prevalent because for the same reason that substance use is used, addictions are for. So there's an underlying cause, there's an underlying reason why a person needs to, has a sex addiction, or has social media addiction, or gaming addiction, because they are calming themselves. They are distracting themselves. And what they are calming themselves from, what they are distracting themselves from, is that underlying reason. Is there conflict at home? Is there boredom? Is there attachment issue in the family? Are the parents not available? Are there racing thoughts a person has, and they use gaming to stop those racing thoughts? So knowing those underlying reasons and understanding them from the parent's perspective, and then reaching for the right help. Everyone is not trained as a therapist for process addictions, because there's a lot of family involvement in process addictions as well. So I recommend clients to reach out for the right help, and then the therapist should know what's the right protocol to support that specific family. And here there's a cultural piece which is very critical and important. Unfortunately, not all therapists would understand it from the cultural lens, especially the Muslim or the Islamic lens. And I hear a lot of my clients coming to me saying that my therapist did not understand, and they are very extensively trained in process addiction, but they miss the cultural piece to it. Yeah.
And that cultural piece is crucial, because that forms the context of the situation of the person. And when we talk about, like you brought up gaming, and so again, these processes, what's driving, like, 8 hours of gaming, or 10 hours, 12 hours, like, which is a common thing now with kids, and even a phenomenon of watching other people play video games, which I find to be, maybe it's my age, I don't understand that. And so these are modern day ailments. And you brought up another issue, which is drug addiction and alcohol addiction, which does bring in, which has most of the attention. And sadly, alcoholism and drug addiction are killers as well. And mental health issues exacerbate the desire, as you said, when people are trying to calm racing thoughts or other kind of negative emotions, they'll medicate with drugs and alcohol. I know our time is limited, but I did want to cover this piece of mental health issues as it relates to drug and alcohol addiction, and what are the supports, or how can even the work that you do and others that are trained to help people get out of physical addiction to drugs and alcohol.
So with process addiction, it's the same. It's self-medication, right? Self-medication in the sense that your brain is producing dopamine when you are following that process. So it is still self-medication. Now, in terms of getting the right help, how to get that right help, there is a BC Substance Use organization. Just search it up. And there are a lot of resources available over there. Read them to understand, and there is a full tab on available for clients. Understand what you're going through. If you are noticing something off, as I said before, and then speak to the first suggestion I always have for people is bring it up to your GP if you have a family doctor. If you do not have a family doctor, speak with your walk-in doctor as well. And then let the GP recommend what's the next course of action.
Okay, and in wrapping up, we covered so much ground, and like you said, every item we discussed deserves to its own specific space to really elaborate on, whether it's addictions or process addiction, gaming, and social media. But the final takeaway for those, again, as we talked about our culture and religious backgrounds, mental health support and mental health treatment, a lot of people, people, because it's intangible, it's not like a physical medication or actual pharmaceutical, it's something intangible that people can't touch or quantify the value, but really the software operating system of our lives is our brains and our emotions. Now, for those that are skeptics and for those that are reluctant, and as you know, there are a lot of people that are resistant to change, but people invest a lot in their physical health through trainers, through diets and exercise and vitamins and supplements and all that. But for mental health, which really affects everybody, it affects our lives, it affects everybody around us, to really, what would be your final message? Again, to take analysis, as you said, when you feel off, or you sense somebody in your family or in your social circle that's off, that they should need some professional assessment from a professional like yourself, and others to be able to kind of help that person professionally, rather than, as you were saying, your father said, "Oh, I have no problems, I don't need help."
It's a difficult question, Tariq, because if a person is an ambivalent and they are not going to get help, then the people around them who could be more aware, they can go get help. And there is a concept called where we may not need to meet the whole family or the person who is experiencing mental health. We work with one person in the family who can be the change agent for the family. And this is exactly what happened in my family, right? I changed my profession, became a traumatologist, and then I went and helped my family. I would recommend that people, family members or friends who are noticing someone, loved one in their life who's going through mental health concerns, call the Muslim Food Bank Aspire program. You can find that telephone number on the website and call them and request to speak to a counselor. And the counselor will be able to guide you and help you navigate through your own unique situation.
Excellent. And just wrapping up, for those that have never had therapy, those that have never had treatment, again, the quality of life, because you are the change agent in your family, the quality of life in your own life and the quality in life in others, for you to be able to understand what these emotional patterns and negative states, to be able to recognize, call them out, and heal them in whichever degree. I think one person has to make that difference in their own family, and take that plunge to get that treatment and help hopefully bring their family members and their loved ones to the same process. Would that be a fair thing to do?
Yes.
So
yes.
So Mobina, thank you so much for taking this time. And as you said, the Muslim Food Bank and Aspire, to be able to contact the organization, for the organization to connect to professionals like yourself for this much needed work. And anyone that has a sense of something being off, as you said, depression, anger, anxiety, resentment, racing thoughts, any number of strange behaviors that one would recognize as off in their own life or others, that they need to reach out and get some professional objective help to help them. So I want to thank you again for the work you do and the profession that you're in, because it is much needed, and especially in this day and age, we definitely need as much help as we can for our community. So I want to thank you again, Mobina. Thank you for joining us. And again, Muslim Food Bank, Aspire. And thank you, Sister Mobina Hasan, for being with us today.
Thank you for having me today, Tariq.